Hello everyone, I'm Dua, a consultant clinical psychologist. So today we'll be talking about children's recovery from trauma. So if you're watching this, you may be caring for a child who has been through something difficult. Perhaps it was a frightening event, a loss, or ongoing stress at home or at school. You're asking yourself, how can I help them heal? Today I'm going to walk you through TF-CBT, which is trauma focused cognitive behavioral therapy, a proven structured approach designed for children and their caregivers who have experienced trauma. So, if you find this helpful, please like the video, subscribe, and share it with someone who might benefit it. So, now let's begin. When we talk about trauma in children, okay, first we have to understand what it is, okay, and what its impact on children. Okay, so we mean experiences that overwhelm a child's ability to cope. Things like serious accidents, violence, neglect, loss of someone important, maybe the fight between the parents, or major change in their lives. Children don't always show trauma in the way adults expect. Instead of just being upset, they might have nightmares or trouble sleeping, avoid places or people or things that remind them of what happened, being unusually irritable, aggressive, or withdrawn, struggle at school with concentration or behavior. They're not just bad behavior. They may be the school, the child's body and the mind telling you that they are hurt inside. As a parent or caregiver, you are a crucial part of their healing. Your presence, your stability, and your compassion makes a powerful difference. A child at school may be experiencing bullying. Okay, the other children might be making fun of him. So for every parent, I would like to say, please always use a mature pathway to for parenting. Always teach your child maturely and tell them, like, being an educated person, it's necessary for you not to make fun of anyone, not to judge anyone. If there is any thing that if he is not good at studies, if he is having any physical issue, if he's having any mental issue, if anything, if he is being quiet, if he's depressed, please teach them basic etiquettes, like how to help and how to assist someone. Okay, because parents are a great role in the upbringing of a child, and then what they observe they do the same. So this is very necessary. Okay, if they're being harassed, they'll do the same. Okay, they'll avoid those places, they'll avoid the person, they won't like to go out. Okay, so now let's talk about what is TF-CBT and why it works. So TF-CBT stands for Trauma Focused Cognitive Behavioral Therapy, and it is evidence-based treatment for children that are 3 to 18 years of age and their caregivers who have experienced trauma. In this short-term and structured way, that is typically around 12 to 20 sessions. And after experiencing any traumatic event, it is really necessary, whether you are a child, adult, if you're in any phase of life, it's really necessary to seek for help, seek for therapy, because that you would share your experience, and catharsis is really important. Okay, it is really really necessary, and the person who you feel is safe is very non-judgmental, only share your feelings with them. So it works in three main phases, and one is skill building and stabilization. It's helped the child and you to build safety and coping skills. And then number two is trauma narrative and processing, gradually talking about what happened, processing the meaning and its impact. Number three is integration and consolidation, applying the skills into everyday life in building a future beyond the trauma. The therapy also includes you as a parent or caregiver. Your role is active. You learn parenting skills, you support your child's coping, and you participate in joint sessions because it's structured, and research shows that it worked in reduced PTSD symptoms and less anxiety and fewer behavior problems. So if you're not just talking, not just hoping things get better, but we are following a map. So what you will do and what to expect as a parent or caregiver. You'll meet with a therapist, your child will meet with a therapist, and later you will meet together in joint sessions. Your job, you provide safe, consistent routines at home, practice coping skills. Your child is learning, support your child when they talk about feelings, offer calm presence when things are hard. So what you may see, your child starts to use breathing or calm down skills. They talk more about what they feel. They gradually avoid school and friends less, and you may feel more confident as caregiver. And it's very important. And healing doesn't happen overnight. They may be setbacks, triggers, days when your child is worse before they are better, and this is a part of the process. You may also have feelings of guilt, worry, sadness, and that's normal. The therapy model recognizes your feelings matters too. There are some simple techniques that you guys can use. There's some relaxation exercise. Sit with your child and say, let's breathe together. Breathe in for 4 seconds. One, two, three, four. Hold for 1 second. And out for 6 seconds. One, two, three, four, five, six. And do it 3 times and then ask, how did your body feel afterwards? One of the most important things I would say with you, if one has gone through trauma, please show them support. Tell them that you are here for them. Hold their hand and be there for them. That is really, really necessary for them. Okay? Don't judge them. Don't say anything bad about them. Their emotional state is, it's so high. They really need you at that time. Please just let them feel that you are here for them. Then feeling check in. At a calm moment, ask, on a scale of 1 to 10, how my body feels right now. Then ask what words fit that feeling. Help them name the feeling. Safety plan posture. Create a visual posture with your child. If I feel unsafe or upset, I do 3 deep breaths, or I go to my safe place. I tell my mom, my dad, and my carer. Then we have trigger log. Use a notebook. What happened? How did my body feel? What thought went through my mind? What did I do to calm down? Over time, you'll spot matters. The spot the patterns that matters, and it help your child get ahead of them. And these are not replacements for therapy. They help you build a bridge between the therapy room and home. And for therapy, you guys can contact me anytime. I'm definitely here for you. You guys need assistance, just let me know. Comment, approach me. I'm here for you to provide therapy. Don't worry at all. But I would just like to say one thing that is more important is a person who has gone through trauma, harassment, or this sort of thing. It's not easy for them to say everything. Like for instance, if he feels like you won't provide them support, you are judgmental and all, no, he won't share anything with you until unless they feel like you will provide them support and you are really non-judgmental. Then they will tell you like what happened. But after experiencing a traumatic event, if you immediately ask a person, he or she might not be able to recall what has happened. Or like for instance, if there is abuse or anything or that's ongoing, and it's been so long, it's been some months or years. So it will be really difficult, and you are not trusting them. So it will be really difficult for them to tell you what has happened, at what time, what place, where, when, how. So it won't be that easy for them. Okay, and I'll also make a video for adults too, because it's really necessary. Okay, and I'll tell you how to heal from that. And then there are some signs of progress in winding down. As the therapy moves through its phases, in the skill building phase, your child gets calm tools. In the trauma narrative phase, your child begins to talk about what happened, maybe draw or write it with your support or with a therapist guide. In the integration phase, your child uses these skills beyond therapy and resumes normal development tasks, connects better with others, but you might notice fewer scary thoughts, nightmare, fewer behavior outbursts, better focus at school, better mood, more trust in you. If you see regression at or a trigger at a time or due to a change at home, know that it doesn't mean failure. It means more support is needed right now, and your consistent presence matters. Your calm, your reliability, your willingness to help your child use the skills, that's a real change. So now I would like to say thank you for staying with me. Now let's wrap up. Trauma can speak in the lives of children through their behavior, feelings, and thoughts. TF-CBT, trauma focused cognitive behavioral therapy, gives a clear path, safety and skills, story and meaning, and growth and future. You, as a parent or caregiver, are part of the part. Your support, your presence, your belief matters a lot. So if one is going through a really tough phase of life, your support matters a lot to them. Don't leave them alone. Believe me, it would be really depressing for the other person. So what's one small steps you will take this week? Maybe it's practicing the breathing exercise once a day. Maybe it's creating the safety plan poster with your child. If you find this video helpful, please like, subscribe, and share with any other parent, educator, or caregiver who might benefit. So, you guys can also let me know. I also create someone do a therapeutic guide and therapeutic training for parents too. It would be really interesting. I would be a whole series. You guys can let me know, and then we'll initiate it for you. For multiple therapies that would be based on the practical techniques that you guys can use, and that would be all based on the techniques that you guys can use for your children. So it would be really helpful for you. You guys can apply it home. Okay. If you need therapy as a parent or for your children or for anyone around, you guys can connect with me anytime. I'm always available for you. Don't feel alone. You are not alone. I'm here for you. There are a lot of people who are suffering. Always focus on the positive attributes, positive feelings, positive things that has happened to you, all the blessings that you have counted. Okay, and be always thankful for it. Okay, and be a really positive person who is spreading positivities and who is, you know, showing care and who is creating a safe space for the people around. Okay, comment below what step will take, and I'll respond. We'll build a community together. Okay, you are doing important work. Your child is worth this journey. Thank you for your courage and care. Take care of yourself and take care of your child. Goodbye for now. See you soon in the next video. Thank you.